Solidarity forever, for the union makes us strong.
I love it. On behalf of Central Regional Council, I welcome on numerous issues. And we have gathered here this morning to articulate the views that our National Secretariat in 2 weeks ago have articulated. So we are also adding up to that solidarity message so that the things that are not going well, we also say it to the government. I am happy that council members are present here. We also have professional association body leaders also present here. We have facility executives also here present. We do also have our members also present here. We are in the regional secretariat of the GPRTU. So we have other unions also present here. And then also the media also is present here. As we have gathered here, we have in our midst the regional secretary for our union, who happens to be our industrial relations officer. And then he will be articulating the union's view for the whole world. So on this note, I will sit down and I will allow our IRO to proceed. Choboy! Hey! Choboy! Hey! Choboy! Hey! Thank you very much.
A memory lane of why we are here and why we have reached this stage. On 21st November 2019, our national leadership, in consultation with other professional leaders who are within the union, had a press conference, gave our employer 2 weeks ultimatum. That 2 weeks ultimatum has expired. We are still waiting for the response of our employer. The employer has refused to even call us to tell us that we've heard, and so come and let's talk. And since they have refused to call us, and we want to make sure that the whole world knows that we are in solidarity with our national leaders, and that what our national leaders said were not isolated, and that we are in full support with them. And therefore, we are gathered here today, not only to render support, but to issue a resolution to our employer, telling them that we are tired of being seen to be weak, and therefore we cannot do anything. We want to tell them that whatever decision our leaders take at the national, we shall abide by it to the latter. And therefore, this resolution is to tell them that we are really serious and we are briefed. Thank you. I'll take you through what we have in our resolution. Now, resolution 1, we are saying, whereas the Health Service Workers Union, representing numerous professional bodies within the health sector, with the exception of the nurses, doctors, anesthetists, and pharmacists, whereas Health Service Workers Union members perform and play an inalienable service to the national quest to achieve the universal health for all and a holistic, comprehensive quality care delivery in Ghana, whereas a collective agreement was signed between the health agencies and facilities under the Ministry of Health and the Health Services Workers Union of Gtuc-Ghana in December 2015, in accordance with the Labour Act 2003, Act 651. The collective agreement, which takes precedence over any other existing agreement, was to take effect from January 1st, 2016. The health agencies are currently either not implementing or undertaking selective implementation of this agreement. This is mainly attributed to the fact that its implementation is dependent on availability of internally generated funds from individual facilities whose IGF are woefully inadequate or non-existent. Indeed, it is interesting to note that some category of health professionals within the Ministry of Health have their condition of service consolidated in their salary and paid from controller and accountant general, which to us is a deliberate discrimination, and we will not tolerate it.
Thank you.
Whereas in 2012, the health sector workers were migrated into the single span salary structure, which had in its additional duty hour allowance, which was before then paid to members, fair wages and salary commission, realizing that the single span salary structure of the members were lower than that of the other members. The single span salary structure introduced a percentage called market premium. Mathematically, the market premium should change as the base pay changes when salaries are reviewed. It is a mystery that the market premium has inadvertently remained stagnated since 2012 for the members of Health Services Workers Union, but has obediently responded to changes in salary for other public sector workers. Such arbitrary freezing of the market premium is tantamount to betrayal of trust, a situation not suitable for cohesion and teamwork among the public sector workers. Whereas the absence of a regulatory council and laws to regulate the allied health profession in the fact that members of the allied health professions were not writing essential exams were cited as reasons why some of our members were not properly placed when they were migrated from the health sector salary structure to the single span salary structure in 2012. It suffices to say that since the introduction of the Health Professions Regulatory Body Act 2013-857, all these three advanced conditions have been fulfilled, yet the distortion and low grading of our members continue to date, despite constant reminder made to Fair Wages and Salary Commission over the issue. This is a clear attempt to frustrate our members, but we stand resolute in our quest to demand our rights. Ladies and gentlemen, and members of the press, we say that our yearly incremental credit, which is a movement from various salary points annually on the same grade, has not seen appreciable increase since 2012 till date. Various checks from the Controller and Accountant General Department showed that the HRM system that is being used in paying salaries do not have yearly automatic incremental notches, and therefore input is done manually, paving way for selective implementation of this vital salary input. This deprivation of the incremental notches has serious consequences on our members' basic salary, as well as their contribution towards retirement. We know in this country, if you want to go on retirement, it's calculated based on your base pay. And therefore, if you have lower basic pay, you have what? Low retirement payment. But this incremental notches ensures that your salary increases. So if it is not done, of course, you remain stagnant and your salary will remain until you go for another promotion. Are we going to sit down and allow it?
No!
Thank you. Whereas teamwork in the health sector is undeniable fact and necessary ingredient in the delivery of quality healthcare in the country, an unexplainable labeling and classification of the staff of the Health Service Workers Union into clinical and non-clinical has been the source of unwarranted discrimination in the award of market premium within the same hospital and facility. Employees classified as non-clinicians are paid lower salaries, and have suffered this inequality all these years, though clinical and non-clinical staffs working in the same environment are exposed to the same risks. Interestingly, despite the Ghana Health Service Council call for the abolition of this unlawful classification, the Fair Wages and Salary Commission have not corrected the labeling and classification. For instance, a clinical staff is paid a market premium ranging from 58% to 220%, whilst a non-clinical staff receives market premium ranging from 15 to 30%. Oh. Hey. Members of the press, this is our story. Whereas we appreciate the dynamism of healthcare that is taking place, it is equally wrong to make some of our members, like the medical physicists, suffer because the single span salary structure did not make provision for this category of staff, whose role are critical to cancer treatment in the teaching and some regional hospitals. Painfully, as it is, this category of our members are placed as either radiographers or biomedical scientists, irrespective of the differences in training and qualification. As a matter of agent, we call on the Fair Wages and Salary Commission to create corresponding grade for this category of staff in the single span salary to bring fairness to the system. You cannot train people, and when you train them, then they come out and you tell them that, oh, sorry, I couldn't make provision for you in the single span salary structure, so I'm putting you anywhere I think you're supposed to be. Is it correct? No. In 2012, in 2017, approval was granted by Fair Wages and Salary Commission for some category of junior staff to be promoted to a 4th grade. These staff were promoted, but without market premium, making them worse off since 2017. To make the matters worse, some started receiving deduction called retro offsets from their salary. Upon the intervention of the Health Service Workers Union, a letter was issued to Ministry of Health, Ministry of Finance, to pay the market premium and the unlawful deductions to the affected staff with immediate effect beginning March 2019, which we deem unacceptable. In the face of this, we maintain that all unpaid market premium and other arrears be paid to the affected members effective January 2018. You cannot start deducting people retro offset from 2018. Then you issue a letter and say start paying in 2019. What happens to those that the money that you deduct? Where is it? We need that money back to the members. Yes. Whereas the National Laboratory Policy, an important document for quality healthcare delivery, has not received any serious attention by the Ministry of Health, though the policy was approved as far back as 2013. The question we ask is why the policy is not implemented. Oh. We therefore call on the Ministry of Health to fast-track the implementation of the policy if they are committed to a holistic quality health in the country. And instead of keeping the policy in the shelf to gather dust, after spending the taxpayers' money to develop it, we say, let the policy work. You can't develop a policy that will ensure that laboratory services are of standard in the country, so that when I do a test in Cape Coast, if I go to anywhere, even in the northern region, Tamale, Upper East and Upper West, and I do the same test, I should have the same result. You put the policy down, and everybody seems to think that it doesn't exist. We are saying the policy exists. Implement it. Whereas we wish to indicate that all this deliberate discrimination and unfair treatment will still serve the people of Ghana with a smile and continue to promote health service willingly and unswervingly, it should not be misinterpreted as a weakness on our part, because we can bite hard. Yes. Can't we bite hard? Yes. Finally, we, the undersigned members and the representatives of the professional association under the Health Service Workers Union in the Central Region, do resolve that the above enumerated issues be given urgent attention as quickly as possible by the Ministry of Health, Ministry of Employment and Labor Relations, Fair Wages and Salary Commission, the Controller and Accountant General Department, and the Ministry of Finance, or else we shall legitimately advise ourselves since the ultimatum the union at a press conference on 21st November in Accra has elapsed, and we are yet to see any light in the tunnel. We shall not sit unconcerned this time round, and so we shall advise ourselves accordingly, because what is good for the goose is also good for the gander. Thank you so much.
Oh!